that part of it. Good morning and welcome to another edition of the Senior Network. I am your host, Dargan Davis, and I am with Senior Resources, and I'm joined today with my co-host, Holly Van Horn, and she is joining us from Lourie Life and Health. Good morning, Holly.
Good morning. Good to see you again.
Good to see you. We are going to give our guests just a couple more minutes to get logged in, and then we will start the program. So while we wait, we would love to know where all of our webinar participants are from. So if you can, drop your city and town in the chat box, and we're going to take a brief pause and we'll start the program shortly.
Yes.
All right, it is time to get started with today's program. Just a few housekeeping notes. This webinar is being recorded and will be available on our website at seniorresourcesinc.org shortly after the broadcast, and also available through Facebook. If you missed our previous webinars, we have a virtual webinar library located on our website at seniorresourcesinc.org underneath the Senior Network. Today's episode will also be available to view later today on that link. I'd like to take a few minutes and share just a little bit about the services that we offer at Senior Resources. We are a nonprofit organization that coordinates services and provides resources to Richland County's senior citizens, helping them to live healthy and independent lives. All of our activities, services, and programs that we offer at Senior Resources are geared towards promoting independent living with the goal of helping seniors remain in their homes for as long as possible through the support of our staff and volunteers. In Richland County, we are the only provider of Meals on Wheels. We currently serve 600 meals daily through this program to our homebound seniors. In addition, we offer home care and transportation services. We have foster grandparent and senior companion programs. We have a pet pal program that serves 49 of our senior clients and a total of 74 of their furry companions. And we have 4 community wellness centers. Our seniors gather at these centers to enjoy fellowship, a hot meal, and they get to participate in a fitness activity. This is Monday through Friday. Our services touch the lives of over 4,000 Midlands residents. The Senior Network is one of our programs offered at Senior Resources designed to connect seniors to even more resources in the community. Please visit our website at seniorresourcesinc.org to learn more information about all of our programs. At this time, we'd like to thank Lourie Life and Health for partnering with Senior Resources to host this webinar series. Holly, I'm going to turn it over to you to share a little bit about Lourie Life and Health and also to introduce today's speaker, Mr. Joel Lourie.
Dargan, good morning, and thank you all for joining us. I'm Holly Van Horn. I'm the Community Relations Coordinator here at Lourie Life and Health, and we are so excited to partner with Senior Resources to offer this webinar series to you, and this is our 3rd one, and it just keeps getting better and better. And today it is my privilege to introduce our speaker, who is a great friend of mine that I get the honor of working with every day. Joel, who is the president and founder of Lourie Life and Health, comes from a background of public service where he served 18 years in the South Carolina House of Representatives and State Senate. He's been recognized by numerous organizations for his work on healthcare, education, and improving the lives of all South Carolinians, particularly seniors and children. In addition, Joel has a 35-year history as a business owner and founded Lourie Life and Health in 2011. Since that time, Lourie Life and Health has grown to be a regional leader in the health insurance and Medicare industry. Joel is a native of Columbia, a graduate of the public school system and the University of South Carolina. The Louries have been in South Carolina since the early 1900s, where the family owned and operated a department store for 96 years. And Joel's father also served in the South Carolina legislature for 28 years. Joel, I think our audience is ready to hear from you now.
Good morning, and thank you, Holly, for that generous introduction. And good morning, Dargan. It's a pleasure for us to do this with Senior Resources. And let me just go ahead and here we go. So hopefully everybody can see me okay. Good morning. And just want to, again, thank everyone for attending this morning. We're really excited to partner with Senior Resources on this great webinar series. We've had some tremendous speakers. Our good friend Sheriff Leon Lott was on first. We had Teresa Arnold on from AARP last month, and this month, since we're getting into the Medicare annual enrollment season, we thought it would be good to go ahead and do something on Medicare. So thank you for joining us this morning. I'm going to share my screen now with you, and hopefully you'll be able to see this presentation. I'm going to talk a little bit about the A's, B's, and C's of Medicare. So give me a second, and let me see if I can go ahead and share my screen. And here we go right here. All right, so hopefully everyone can see my screen right now, and we're going to do a little bit of a little slide sales presentation here. So again, want to thank you for joining us, and I'm Joel Lourie. I'm going to talk a little bit just this morning about how Medicare works. Lots of people have questions. Sometimes it tends to get very confusing, so I thought we'd take maybe the next 10 minutes and just talk a little bit about how Medicare works. Then we'll leave some time for Dargan and Holly, who, by the way, are just fabulous hosts for this show. So delighted to work with both of them to ask some questions. So let's just start right here with my screen here. And you can see that this block right here that says Original Medicare would be your basic red, white, and blue Medicare. People over the age of 65 are eligible to join Medicare, or those people that have been on disability for 24 months that are under the age of 65. So A and B is your basic Medicare coverage. And what does that mean? Let's just talk a little bit about that. Most people will get Part A at no cost, and they'll get Part A at no cost because they have been either them or their spouse has worked for 10 years or 40 quarters over the course of their lifetime. So if a wife is working and a husband's at home, or a husband's working and a wife stays at home with the children, that doesn't matter. If either member of that household has worked 10 years or 40 quarters, they're eligible for Medicare. All right, Medicare Part A doesn't cover anything, cost you anything, excuse me, that covers a lot, doesn't cost you anything, and it covers your hospital visits if you go into the hospital. It basically is your room and board. Now, with Medicare Part A, there is a $1,484 deductible. So in insurance world, what that means is if I check into the hospital, I've got to pay $1,484 as my deductible, and then my Medicare covers the rest of the room and board. It doesn't cover what the doctors do, so we're going to talk about that now with Part B. Part B covers any doctor and outpatient costs. So if I see a doctor while I'm in the hospital, of course I will, or I go to a doctor's office, or I go to an outpatient, Part B is going to cover that. Most people will pay $148.50 for their Part B. That's the standard premium. Medicare Part B is based on one's income. So higher income households will pay more, but the vast majority of people pay $148.50 for their Medicare Part B. And the annual deductible on that is $203. So let me just pause right there. That is essentially what your red, white, and blue card will cover. If I go into the hospital, I've got to pay a $1,484 deductible. If the doctor sees me, I've got to pay a $203 deductible. I'm paying $148.50 a month for my Medicare premium. If I'm on Social Security, it will automatically deduct the $148.50 from my check or from my deposit. If I go to the doctor, Medicare is going to pay 80%. Part B is paying 80%. I'm going to pay the other 20% after I pay my annual deductible. So again, Medicare is paying all of your hospital and 80% of your medical after you pay the deductibles. Virtually no one will stay on regular red, white, and blue Medicare because it can leave you very much exposed with other costs. You can pay 20%, and let's just again say you go in and have heart surgery and you have a $50,000 bill. That 20% could cost you $10,000 and would be a very unpleasant surprise when you go to the mailbox that day. Likewise, when you go to the doctor, you would have to pay 20% every time you go in for any service. And regular Medicare doesn't provide what we call a ceiling or an out-of-pocket maximum. You just keep paying till you can't pay anymore. So that's where you have choices to make, and that's really where our agency specializes in South Carolina in educating people on these choices. There's no right or wrong decision, and our company represents all the plans. So we're not what we call a captive, we are what we call an independent. We're going to look at all the different plans and find the decision, find the option that makes the most sense for you. Let's talk about option one first. Option one is called a Medigap plan or a Medicare supplement. These terms are synonymous. So you've probably seen or heard your friends talk about my Medigap, my Medicare supplement, my Plan F, my Plan G. They all mean the same thing. If I'm turning 65, which I'm not anytime soon, but if I'm turning 65, that plan right now is going to cost me between $100 to $150 a month. Okay. And if I get that plan from Blue Cross, Humana, United Healthcare, Aetna, all the plans offer the same benefits on a Medicare supplement. Right now, the most popular plan is what we call a Plan G, and a Plan G is going to pick up that 20% with the exception of the deductible. So I'm going to get my Medicare supplement. I'm going to pay my monthly premium. Usually that's paid through an automatic bank draft, and I can go to the doctor and not worry about the 20%. One of the other advantages of a Medicare supplement is that there are no networks, okay? So any doctor that accepts Medicare will accept your Medicare supplement. So you don't have to worry about, whether you travel. Good example would be if you want to go to a specialty hospital like Mayo Clinic or MD Anderson, because they accept Medicare, they will accept your Medicare supplement. You don't pay the 20% and have to get reimbursed. They simply just bill the insurance company for the 20%, and that takes care of everything. A Medicare supplement does not come with extra benefits like dental or vision. So if an individual member wants to look at those, we offer special plans, or most insurance agencies do, for dental and vision. It also does not come with your drug coverage. So what we always do there is look at something called Medicare Part D. Obviously, D stands for drugs. And what we'll do there is we'll look at a member's drugs, we'll take a list of their drugs, and then we'll run them through the government-sponsored website, medicare.gov, and determine which Part D plan is the best fit for that particular client. It may or may not be the same company that we get your Medicare supplement through, and it may or may not be the same company that your spouse gets their Part D plan from if you're still married. Because remember, here in South Carolina, most counties will have up to 26 to 28 Part D plans. So it's real important that you work with somebody that's going to take the time to research your prescription drugs because making a bad decision on a Part D plan simply because someone failed to do the research could cost the client thousands of dollars a year, if not more. All right, that's option one. I'm going to move over now to what we call option two, which is a Medicare Advantage plan, or you could call it a Part C. These terms are synonymous, and you probably have seen football players, Joe Namath or others, get on TV and talk about these plans. These are very, very popular plans. These plans will offer all the benefits. It's an all-in-one Medicare plan. So, for example, it combines your A and your B. Most plans will include prescription drugs and offer additional benefits. These premiums on these plans can be as low as $0, and most of the plans in South Carolina aren't any higher than $15. So $0 to $15. And in this case, the insurance company is managing your health care. You are still a member of Medicare, but now the insurance company is managing all of your Medicare benefits for you. In these plans, you pay copays. So if you go to a primary care physician, you might pay a certain amount. If you go to a specialist, you might pay a slightly higher amount. If you go into the hospital, you'll pay a nightly rate up to a certain number of days. These plans do include extra benefits. Most of them now include dental. They include a vision benefit, some sort of hearing benefit. And now today, they even include gym memberships. You've heard of companies like Silver Sneakers or Silver and Fit, where you can go to a gym at no additional cost as part of your membership. We've seen a tremendous growth in the Medicare Advantage market really in the last 5 years. In South Carolina, it's become very popular, but our agency and our agents are trained to offer both plans because there is no wrong decision. A member that may have a lot more disposable income, that doesn't want to worry about copays or networks, is going to choose a Medicare supplement plan. A member that might be a little bit more budget conscious, but wants to have great protection, have fixed copays, might choose a Medicare Advantage plan. These plans do have networks, but most of the networks are very, very broad and even allow you to travel out of state. The other great thing about a Medicare Advantage plan, and as I mentioned, most will include drug coverage, is that they have something called a maximum out-of-pocket. So this is very important because you may recall when we talked earlier about regular Medicare, there is no cap on what you spend. You just keep spending until you can't spend anymore. But with a Medicare Advantage plan, these plans will have what we call maximum out-of-pockets. They can range from $5,000 to $7,500 on your medical. Does not include drugs, but on your medical. And then if you reach that, the plan would pay for the rest. I rarely see a member reach their maximum out-of-pocket. One would have to have an extremely challenging year from a healthcare standpoint, would have had to have been in the hospital several times, maybe go to a skilled nursing facility and get some chemo to ever reach their maximum out-of-pocket. We rarely see it, but on a rare occasion we do. So just kind of to summarize, Holly and Dargan, option one, Medicare supplement, and Part D, no network restrictions, pay a monthly premium. Once you hit your deductible, then the plan pays the rest on your medical. On the Part D plan, you pay your premium, and then you do pay co-pays for your prescription drugs. Medicare Advantage, much lower monthly premium, $0 to $15. It's going to include that prescription drug benefit. It's a copay system, works very similarly to a group plan. You pay copays when you go to the doctor. You pay copays for x-rays. It will include your drug coverage, and it has a maximum out-of-pocket. So I'm going to pause right now and mention one other thing, Ms. Holly, and then turn it over to you because I see we've had a few questions that have come in. What's really important for members to understand is this, is that we are right on the eve of what's called the Medicare annual enrollment period. And the Medicare annual enrollment period from October 15th to December the 7th is when members can change plan in their Medicare Advantage or Part D plans without any problems. In fact, in some cases, it's the only time, in most cases, they can change plans. So that's why you'll see lots of TV commercial on TV, including yours truly, my apologies, where members will ask, will want to change their plan, want to change their drug plan, and we will help them do that. Lourie Life and Health, real quick, we're local. We have offices throughout the state, and we do like to encourage members to work with a local agency who will be there both now, but also in the future to be an advocate for their clients. And with that, Ms. Dargan and Ms. Holly, I'm going to turn it back over to y'all to answer any questions you have.
Thank you so much for sharing all that information about Medicare. And we're going to open it up to see if anybody has questions. And please just drop those in the chat feature on your screen and we will get to them. Until we have a few questions come in, I'm actually going to ask a few things of you, Joel. When should you start the process of signing up for Medicare? For instance, if you were to turn 65 next March, how early before that birthday, that big birthday, should you start researching and planning?
Well, that's a great question, Holly. And Medicare allows you to sign up for parts A and B 3 months prior to the start of your 65th birthday. So first of all, it's important to note that members that have a birthday in March will start their Medicare March the 1st. So whether your birthday is the 15th or the 23rd or whatever in March, your Medicare coverage will start the 1st of March. There is an exception to that. If somebody has a March 1st birthday, it will start in February, but let's just stick with the March right now. So I want to sign up for Medicare 3 months before. So if you go back 3 months, that would be February, January, December. Starting in December or January is the time where you would want to sign up for Medicare and also meet with somebody to let them explain how this is going to work, what's the best fit. Some people might be interested in the supplement option. Some people might be interested in the Medicare Advantage option, but that's the time where we want to sit down and really start having those conversations, doing the research, making sure doctors are in network, so that when they get their card in the mail, we will go ahead and enroll them in whatever option they choose, many cases 45 to 60 days before their Medicare starts. So it's a very seamless transition into their new coverage.
Thank you.
Good.
If someone wants to change their Medicare Advantage plan, when can they do that?
Great question. And that would happen again October 15th to December the 7th. If they're on a Medicare Advantage or even a Part D plan, they can change at that time. Once they join a new plan, they'll automatically be disenrolled from their previous plan. And one thing I want to mention about that, Holly, is since the onset of COVID, our agents have become very good at doing telephonic and virtual appointments in addition to in-person appointments. We offer all three, and we even offer the opportunity to send an agent into a client's home if that's what they would prefer. But the next, starting October the 15th all the way to December the 7th, that 7-week period is when people can change plans.
Great. All right, we have a few questions from our audience. Ms. McCoy wants to know what happens when you are still working?
Great question, Ms. McCoy. A lot of that depends on the size of your company. If you work for a company with less than 20 people, then the group plan in most cases will no longer cover you and you'll want to sign up for Medicare. If your company is more than 20 people, then you have a decision to make about whether you want to sign up for Medicare now or delay.
Your stuff is ready on the stove.
Okay. And somebody's stuff is ready on the stove. But anyway, whatever it is, if it's good, I'm coming over. But so it just depends on the size of your company. Even if you work for a company that's more than 20 people, you can still sign up for Part A and defer your Part B. And sometimes that can save you money if you go into the hospital. But if you have any questions, work with an advisor, work with one of our agents, call the office. We'll be glad to help.
That sounds like the best advice. We have another question from Ms. Evans. Do you recommend having your Medicare coverage reviewed every year? My husband and I came to your office a few years ago and we're very pleased with your service. Thank you, Ms. Evans.
Thank you. Sure. Good question. And good morning, Ms. Evans. And here's what we tell our clients. Generally, we are not big proponents of changing plans every year. So here's what we recommend. if you've been happy with your plan, if your prescription drugs have not changed significantly, or if your doctors have not changed and everyone's still in network and your prescription drugs are covered and you've been happy with the service, we suggest staying put, because once you change plans, you're going to get a new card, you got to show your doctor, and you got to show your pharmacist. So if you're happy, chances are you should stay right where you are. Contrast to that is if there's if things have changed in your life, if you're taking some new prescription drugs that you notice are a lot more expensive on this plan, or perhaps a doctor is not network, then it would be a good time to review. I would say 85 to 90% of our clients, once we find a good home for them and the right plan, they stay put. But we are happy to help anyone that wants to review it just to reassure them and give them the comfort that they're in the right fit for their situation. Great question. And thank you for being a loyal customer of Lourie Life and Health, Ms. Evans.
Great. Couple more questions from Mr. DeGuire. Is there a maximum out-of-pocket amount with Medigap plans?
So, Mr. McGuire, that's a great question. I asked that same question when I first got my insurance license. But if you remember, you don't need a maximum out-of-pocket because once you pay your deductible, that's all you pay. You pay that first $203 for Part B, your plan pays everything. So whether you're in the hospital all year long or whether you are in and out, just once, go to the doctor, you don't need one because there's no ongoing cost to you other than that Part B deductible. And here's the good thing I want to mention about Medicare supplement plans and Medicare Advantage plans. Once you're in these plans, and as long as you are paying your premium, you cannot be disenrolled if you have bad health. So you are very well protected on either side of that option table we showed you.
Great. All right. And Mr. Canfield wants to know, can an individual have an HSA plan to cover the Advantage copays and max out of pocket?
That is a great question. So I know that an HSA can help with the Medicare supplement plan. What I need to find out on that one particular question is can you use those for your copays on a Medicare Advantage plan? And I'll tell you what, if you will send an email, and I'm going to give you our contact, send an email to Joel, Joel. I'll just put my contact on the screen here. How about that? I'll put it in a chat. If you'll send me an email to joel@LourieAgency.com, or you can call us at 803-256-2067, and I'm going to put that there too. I will get you the answer to that question because we're seeing more and more retirees now with HSAs, and we have someone in our office that's an expert in that area, and I just want to confirm that I'm giving you the right information. I want to thank everybody. Holly, did you have any more questions?
I do have one more. What does it cost to deal with your agency, to work with your agency?
That is a great question. And the answer to that is it doesn't cost a dime. I'm going to see if I can text that somebody real quick and get you an answer to that first question. But the answer to that question is it doesn't cost a dime to deal with Lourie Life and Health. Our service is at no cost. We get paid by the insurance companies a commission. It doesn't cost you anything extra if you come through us versus going directly to the insurance company. The premiums and the plans are what they are. And I can tell you, we have seen a lot of people that come into our office that unfortunately had a bad experience with the call center. Nobody was there on one of these national call centers to answer questions, to be an advocate in the future. So we really, and if you have an agency, what's most important to me is you get good advice. If you have a local agent you work with that's going to be there 12 months out of the year to answer your questions, it doesn't have to be a Lourie Life and Health agent. This is one of the most important decisions that you can make in your life, and we strongly recommend that you deal with somebody local. Holly, I'm going to get you an answer to that last question about the HSA and shoot it over to you. So perhaps in the next part of the presentation, you can just give them the answer. Is that okay?
That's perfect. And actually, I'm going to turn it over to Dargan now, unless anyone else has one more question. And Dargan has a little bit more information she's going to share with us. Thank you.
Good. Thank you. And let me see if I can.
Okay. Thank you, Joel, for that very informative information on the ABCs of Medicare. And if any of you have any additional questions, Joel has dropped his contact information in the chat box, so be sure to reach out to him at Lourie Life and Health. This is the portion of our webinar now where we spotlight we do a community spotlight on a local nonprofit. And this month's community spotlight is the South Carolina Respite Coalition. The South Carolina Respite Coalition provides respite opportunities in South Carolina to families caring for a family member with special needs or an aging adult with a special health care need. According to the South Carolina Respite Coalition's website, respite is a temporary short break providing hands-on care for a loved one who has a significant disability, special need, or chronic illness. It is a chance for caregivers to rest, relax, and recharge, and helps avoid or delay costly out-of-home care placements. We're excited to have the South Carolina Respite Coalition as our community spotlight this month, and they are going to share in just a brief, short 2-minute video about their mission and their cause and how they can help provide respite for caregivers caring for an aging adult. Joel, can you turn me back over as the host and we will share that video?
Just 1 second, Dargan. He's on his way to do that. He was actually finding out the answer to the question, and there he is.
All right, good. Real quick, Dargan, I'm gonna make you the host again. But before I do that, the answer to the question the gentleman asked about the HSA is once you join Medicare, you cannot contribute to your HSA, but you can use your HSA to make your copays while you're in a Medicare Advantage plan. You cannot use them to make your premiums for a Medicare supplement plan. Don't ask me why I didn't set the rules, but that's just the way it is. So you can use them on a Medicare Advantage plan. Now let me see if I can figure out how to make Dargan the host. She is much prettier than me. There you go. You should be the host now.
Thank you. Okay, so we are going to now turn, we're going to do the community spotlight. It's a short 2-minute video. We appreciate all of you who are joining us today. And after we do the community spotlight, we will be wrapping up this webinar, but we are going to roll this short 2-minute video to tell you a little bit about the Respite Coalition.
Family caregivers are the often forgotten healthcare providers in our communities. On average, 1 in 4 adults are a caregiver with home as the primary place of care for those with disabilities and special needs. Most caregivers provide care for their loved ones for 5 or more years. They are providing care along the lifespan, from infants to the elderly, with many caring for both younger and older loved ones. While family members want to care for their loved ones, the continual strain of providing ongoing care can often cause physical, emotional, relational, and financial hardships. So how do caregivers look after their own wellness too? That's where respite can come in. Respite is a temporary short break from providing care for a loved one who has a significant disability, special need, or chronic illness. It's a chance for caregivers to rest, relax, and recharge. Respite is the most requested service by family caregivers. It has been shown to reduce stress and social isolation, help improve caregiver health and well-being, bolster family stability, keep marriages intact, and help avoid or delay costly out-of-home placements. Respite may be provided in a variety of settings, including the home, adult daycare centers, hospitals, community facilities, or residential care facilities. Types of respite include skilled and unskilled care. Respite care may be provided by formal providers who are hired and trained by an agency, or informal providers who come from faith groups, schools, support groups, or family and friends. Respite can take many forms, from going away on a mini vacation to having someone stay in your home for a few hours so you can run errands, take a nap, read a book, have lunch with a friend, or get to the doctor yourself. If you are a caregiver for someone, consider using respite to help yourself and the loved one you are caring for. It's okay to take a break. The South Carolina Respite Coalition's mission is to expand quality respite opportunities throughout the lifespan for South Carolina families who have a member with special needs. Through education, advocacy, state, and national partnerships, the South Carolina Respite Coalition is committed to addressing the unmet needs for respite across the lifespan for all persons caring for a child or adult with special needs. Visit our website or contact us to learn more about respite and how we serve South Carolina. It's okay to take a break.
All right, well, as we wrap up today's episode of the Senior Network, we would like to thank all of you for joining us. Save the date for next month's edition on Thursday, November 4th at 10:30 a.m. We will have our guest speaker, Erin Jeffords, and she is going to speak about fall risk prevention and home modifications. The registration for that webinar is active and it's posted on our website at seniorresourcesinc.org under the Senior Network. We would like to thank Lourie Life and Health and Joel Lourie again for their assistance in making this program available to seniors in the community and throughout the state. Please share this video with any family or friends that you think can benefit from the helpful tips that were provided today on Medicare. This webinar will be available on our website, and the link will also be posted on our Facebook page later today. We encourage our viewers once again to visit our website at seniorresourcesinc.org and to find out about all of the activities and programs that are offered at Senior Resources that are all geared towards helping seniors live independent and healthy lives. We hope that you enjoyed today's webinar and you'll join us next time on the Senior Network. Thanks.
Thank you.
Thanks, Holly.